Hey everyone, let's talk about a hidden danger, Buruli ulcer. This disease is not very well known, but it can have devastating effects on those who get it. It's a serious infection that can cause big sores on your skin, which can be extremely painful and difficult to treat, and sometimes even your bones. The infection can spread deep into the body, making it even more dangerous. If it's not treated, it can cause disability and even death. The impact on a person's life can be severe and long-lasting. This is a problem all over the world, but mostly in tropical and subtropical places. These regions are particularly vulnerable due to their climate and living conditions. It especially affects poor communities that don't always have easy access to doctors. These communities often lack the resources needed to effectively combat the disease. We're going to explore its history, what causes it, the symptoms, and how to prevent it. Understanding these aspects is crucial for managing and preventing the disease. Knowing about this disease is the first step to controlling it and getting rid of it. Education and awareness are key components in the fight against Buruli ulcer. By spreading the word, we can help people and encourage communities to be careful. Community involvement is essential for effective disease control. Together, we can work to stop the suffering caused by Buruli ulcer. Collaboration between healthcare providers and communities can make a significant difference. Let's dive in and learn more. There's a lot to uncover about this disease, and the more we know, the better equipped we are to fight it. Let's look back at the history and evolution of Buruli ulcer. 100 years of Buruli ulcer, a disease that has puzzled and challenged medical professionals. We've known about Buruli ulcer for over a century, yet it remains a significant health issue in many parts of the world. A British doctor named Sir Albert Cook first described it in Uganda in 1897, marking the beginning of our understanding. He saw patients with serious sores on their skin, which were unlike anything seen before. At first, it was called Bairnsdale ulcer, or Searle's ulcer, named after the regions where it was found. But later, it was named Buruli ulcer, after a district in Uganda, where many cases were reported. Over the years, we've learned a lot more about it, including its bacterial cause and modes of transmission. Early research tried to figure out what caused it and how it spread, leading to many important discoveries. Now we understand the disease better, but there's still more to learn, especially in terms of treatment and prevention. More research is really important to find better ways to prevent it, diagnose it, and treat it effectively. By looking back, we can learn from the past and work towards a future without Buruli ulcer, ensuring better health for all. Here's the bad guy, a bacteria and its secret weapon. This tiny organism is more dangerous than it looks. Buruli ulcer is caused by a bacteria called Mycobacterium ulcerans, which is related to the bacteria that cause tuberculosis and leprosy. These bacteria are part of the same family, but Mycobacterium ulcerans has a unique and deadly twist. This bacteria makes a special poison called mycolactone, and that's what causes the serious damage. Mycolactone is a potent toxin that disrupts cell function and leads to severe tissue damage. Mycolactone destroys skin cells and the fat underneath, which makes the sores. These sores can become large and very painful, leading to significant health issues if not treated. The poison also weakens your immune system, making it hard to fight the infection. This means the body struggles to heal, and the bacteria can continue to cause damage. We don't know exactly how it gets in, but it might be through small cuts or insect bites. These tiny entry points can allow the bacteria to invade and start its destructive process. Once inside, the bacteria grows and releases the poison, causing a lot of damage. The spread of the bacteria and its toxin can lead to extensive tissue destruction. Understanding this bacteria and its poison is super important for finding the right treatments and ways to prevent it. Researchers are working hard to uncover the secrets of Mycobacterium ulcerans. By targeting the bacteria and stopping its poison, we can fight Buruli ulcer. Effective treatments and preventive measures can save lives and reduce suffering. Let's see where it hides, where Buruli ulcer lurks. Buruli ulcer is mostly found in tropical and subtropical places, near still or slow-moving water. The disease is common in several countries, especially in West Africa. Countries like Côte d'Ivoire, Benin and Ghana have lots of cases. There have also been cases in Australia, Asia and South America. In Australia, it's found near the coast of Victoria and Queensland. Things like the environment, what people do, and how easy it is to see a doctor all affect where Buruli ulcer is found. Knowing where it spreads is important for stopping it. Section 5. Figuring out the mystery how the ulcer spreads. We don't know exactly how it spreads, but there are some ideas. Touching dirty water might be a big reason. People living near still water that they use for everyday things might be more at risk. Things like washing clothes, bathing, or fishing in dirty water might expose people to the bacteria. Another idea is that insects like mosquitoes might carry it. Cuts or insect bites could be how the bacteria gets in. Buruli ulcer isn't contagious and doesn't spread from person to person. Section 6. Know your enemy, symptoms, and progression. It's important to recognize the early signs so you can get diagnosed and treated quickly. It usually starts as a painless bump or swelling under the skin, like an insect bite or a small boil. As it gets worse, the bump turns into a painless sore with a raised edge. In serious cases, the sore can go deep, affecting muscles, tendons, and bones, causing long-term problems. Buruli ulcer can also make you feel sick with fever, chills, and tiredness, but this isn't as common. Section 7. Protecting ourselves, prevention strategies. Preventing Buruli ulcer is everyone's job. Avoiding dirty water is really important, so use safe water for drinking, cooking, and washing. Wearing long sleeves, pants, and boots can help protect you. Bug spray can keep away biting insects that might carry the bacteria. Telling people about the disease, how it spreads, and how to prevent it is also very important. 8. Section 8. Fighting the disease, diagnosis and treatment. Getting diagnosed and treated early is super important. If you think you might have Buruli ulcer, see a doctor right away. Doctors use exams and lab tests to diagnose it. Treatment usually involves antibiotics and wound care. Taking care of the wound helps it heal and prevents other infections. This includes regular cleaning, changing bandages, and managing pain. 7. Section 9. Staying safe on trips. Precautions for the wanderer. If you're traveling to places where Buruli ulcer is common, be careful. Learn about your destination and the risk of Buruli ulcer. Talk to a doctor about vaccines and medicines you might need. Wear protective clothes and shoes when you're in the water, and stay away from still water if you have any cuts. Keep an eye on your health after you get back and see a doctor if you have any unusual skin sores. Section 10. Let's do something. Awareness, our greatest weapon. Buruli ulcer is a silent danger affecting vulnerable communities. Spreading the word is super important to control it and get rid of it. By learning about it and telling others, we can help people stay safe and get treatment quickly. Governments, healthcare organizations, and communities need to work together to track the disease, make it easier to see a doctor, and support research. Let's work together to fight this disease and create a future without Buruli ulcer. Together, we can make a difference.